Thank you for joining us for this Pharmacy Times Peer Exchange panel discussion. A team approach is essential to improving outcomes for patients with type 2 diabetes. Pharmacists are increasingly taking on a provider role and are on the front line when it comes to providing patient education, addressing barriers to adherence, and communicating to physicians about therapeutic optimization. This peer exchange will explore the role of the pharmacist in improving diabetes care, and will discuss the challenges and opportunities for better collaboration among members of the healthcare team. I'm Dr. Troy Trigstead. I'm the Vice President of Pharmacy Provider Partnerships at Community Care of North Carolina, located in Raleigh, North Carolina, and I'm also the Editor-in-Chief for Pharmacy Times. Participating in today's discussion are our distinguished panelists, Dr. Trip Logan, community pharmacist and pharmacy owner in Charleston, Missouri, and partner at MedHere Today. Dr. Dhiren Patel, Associate Professor of Pharmacy Practice at Massachusetts College of Pharmacy and Health Sciences University, located in Boston, Massachusetts, and Clinical Pharmacy Specialist for Veterans Affairs, Boston Healthcare System of Boston, Massachusetts. Dr. Stephen Peskin, Executive Medical Director for Horizon Blue Cross and Blue Shield, and Associate Clinical Professor at Robert Wood Johnson Medical School of New Brunswick, New Jersey. And finally, Dr. Richard Wynn, Clinical Instructor at UNC Chapel Hill, Partner at AGF Ballantyne Family Medicine and Family Physician in Charlotte, North Carolina. Thank you all so much for joining us. Let's begin. We wanted as a panel to discuss the clinical and economic burden of diabetes in the United States today. And to frame this discussion, I think it's important to remind ourselves that roughly 30 million people have diabetes in the US, and roughly 84 million folks have prediabetes, which is about a third of the adult population. And so, Stephen, I'd like to start with you. What is the global economic and humanistic burden of diabetes in the US today?
So, Troy, great question. Unquestionably, this is one of the most profound, serious, consequential clinical conditions that we as a society face, and increasingly globally. We're seeing the increase in diabetes in the developing world as well as in the developed world. So we see diabetes, the numbers are increasing, the confluence of diabetes with other chronic conditions. So we really recognize that diabetes is extremely consequential. It has profound impact and a profound burden on the health of our population. It leads to many chronic conditions, or is associated with and as an accelerator of many chronic conditions. We see the total cost of persons with diabetes being substantially higher than other persons. And again, the absolute numbers are just staggering.
And to add to that, I mean, if you look at just our population, you mentioned diabetes, we still have a lot of work to do in just glycemic control of those that are diagnosed with it. And so we know about 40 to 50% are not at A1C goal, another 20 to 30% are at an A1C goal greater than 8, and we're not even talking about those patients that are in the pipeline of the other 86 million that you mentioned who don't even probably know that they have diabetes. And so again, extrapolate that, multiply that, and you can kind of see how this economic burden is going to get bigger and bigger.
So what I hear you saying is problems are opportunities, and there's ample opportunity out there.
Absolutely.
I think that it's under-recognized that it's not just a multi-system disease for the person, it's a family disease. It affects, the cost of it is extraordinary, and the impact on employment, attendance at work, well-being of the family is extraordinary. So managing it is a family problem.
So what you're describing in a family practice is that you have patients with diabetes, diagnosed diabetes, but when those patients come to the office, they're bringing with them more than just their diabetes.
Oh, yes. Not just, I mean, just diabetes plus the consequences of the diabetes. The cost of their care is exceptional and changes decisions made by the rest of the family for all kinds of things, educational opportunities included. The impact on the family's choices of diet and activities, and it requires the entire family getting involved to have the diabetic improve. And if they don't, the rest of them will follow with the diabetic disease as well.
So as a proportion of your total activity in a practice, and you have a small family practice, what percentage of your total activity revolves in and around diabetes for your practice?
In my practice particularly, it's probably about 40%.
Of all of the activity going on in the practice?
It's a touch intensive disease, because it's not just, okay, you've got this, I'll prescribe this, and take that, and we'll be fine. It's how did you take that, when did you take that, and what are you eating, and are you exercising, and so how are you doing with other areas of your life that are impacted by it. So it takes a lot of support, and there's so many messages in our society that lead against diabetic control, from our economy that pushes the worst type of food on people, and so many programs that are pushing low-fat diets instead of the more modern, high-protein, low-carb diet that leads away from diabetes.
Staying with Richard, still seeing patients one afternoon a week, which I enjoy tremendously. Diabetes, hypertension, and dyslipidemia. I can't tell you how many times the resident comes in and says, Dr. Peskin, this 56-year-old Hispanic is in today with diabetes, hypertension, and dyslipidemia or high cholesterol. So it's a very, very common refrain. I don't know if it's 40%, but it's very high.
Yeah.